this third and final session with Dr. Gajanan. Now, if you're ready to boost the success rate in so-called acute cases, and especially those acute crises and emergencies in pathological conditions, then this training is all about that. Now, Dr. Gajanan today enjoys a very high success rate in these crisis situations where patients today directly come to him before going to a conventional practitioner because he can provide the results even faster than their GP. And so this is our third lesson, and it's all about answering your key questions on his approach. Now, if you've missed the last two sessions, I highly recommend you to go and check them out if you want to succeed in such acute conditions and manage an acute crisis instantly or improve your current resolution pace as well as rate. So you will find all the links to them on this page. And today he answers the most common questions that you have on implementing his system. And we're going to cover as much as we can because time's running short. But this is what you've covered so far. In part 1, Dr. Gajanan shares his amazing journey into how he transformed from a conventional doctor and a skeptic to a homeopathic doctor who got addicted to giving those fast results in acute critical situations. In the second part of this interview series, he trains us through his system of managing an acute crisis in a step-by-step manner. And today, it's building on that and answering all your common issues, your concerns, your objections you've sent me through my survey, and also in the discussion forums when working with acute situations in your clinics. So welcome back, Dr. Gajanan. Now, one of the most common concern in most practitioners, especially beginners, is what do you do when the patient is unable to talk or give any symptom? I mean, many patients can't describe their pains, or they give really vague symptoms, or the mom's stressed and, everything around is chaotic. How do you prescribe for them?
This is a very common state that happens in our clinics, that a patient comes crying or in pain, or a small child of just few months old brought to us with a mother also few months old. She doesn't know much about the child. Or you have to visit a hospital and a patient is in a state of complete coma and not able to give his history. In such conditions, actually you do very well, though your resources are limited, but they are definite. Now, for example, the small child whom you know that this child has been extremely talkative otherwise comes to you with severe fever. And in fever, you see the child dull, morose, lying down, not answering your questions. And you ask him, how are you? He will say, just nod his head. Or he'll just answer in yes or no. You persist with it, and he still continues the same thing of answering either monosyllable or answering nods. This behavior, which is adapted during the illness, is actually the indication of the patient's state within. If you open up the repertory, the only remedy to this state is pulsatilla. Very simple, but you have to have other evidences like the thirst and open air ML rates and other symptoms should match. But this becomes the entry point to the case who doesn't speak well. Now, if you go to a hospital and you have a patient of dropsy for that matter, where there's a renal failure and the patient is in a completely stuporous or a morose state and is not in a position to answer or not even conscious to answer. So when you examine him, touch the patient top to bottom to examine, and you see his pulse. If the pulse is irregular and feeble with dropsy, one of the very beautiful remedies which has done miraculous results is Apocyinum cannabinum. Another example that I can give you is about a patient with fever who's completely stuporous, dull, not opening his eyes even. You see his blood test and he is in septicemia and not responding. In such cases, even if we examine the pulse and the pulse is not in proportion to the temperature, that is, in every 1 degree rise of temperature, the pulse should be around rising by 10, but it doesn't rise by that. The one of the most efficacious remedy that I have used is pyrogenum. Another case I can tell you about is fever, where the relative describes that every time he gets this fever with chills, it is the lips that start to shiver first. And when you see the lips trembling as the chill starts, the only remedy is bryonia. Then you can collaborate with the thirst and the other symptoms of bryonia. Many times, if you are examining a patient of cancer or a dreaded disease and you see a smiling face, and then you are actually not able to understand why this patient is smiling. Underneath that smile is the suppressed grief, a severe sorrow that he has already buried himself with. This smile is of agremonia. Very good remedy. And you will see a relief coming to the patient immediately. Children, for example. Now, it is very difficult to differentiate children when they are crying, and many a times they are brought to you crying in their complaints. How to differentiate the cry of a child? The commonest that you see is the chamomilla child. If you see Camilla's child, the cry is shrieking. He doesn't want to be touched. The moment you go to touch him, he'll be shrugging you off or even try to hit you. It comes from the family, which is the injury family, the compositive family, which has injury remedies like arnica. So every touch for him is like as if you're going to injure him. So he wants to hit you back. But a sinner who comes from the same family, when you go and touch him, he has an aversion to be touched and he doesn't want that you to touch him, but he allows you to touch. He will cry, but he will not hit you. But if you still are not able to differentiate on the crying, you touch the scalp of the chamomilla child and it's a warm sweat. And in sinner, it is a cold sweat. Just that differentiates. Then you collaborate with the rest of the symptoms. So a stramonium child who has a severe fear of being hurt, the moment you go near him he cries, but the moment you go away from him he stops crying. For a chamomile child you can't stop him from crying once he starts crying. Very difficult to get consoled. You have to take him out, run him around with him. A rapid motion ameliorates. That is one of the most important features of a chamomile child. You have to just move around. But for a Sina child, you just take him over the shoulder, he feels better. And for a stramonium child, the same crying child, you go away from him and he feels better. A patient with breathlessness, an old man whom you are seeing, and if you see his reports and you see that the heart is completely in a state of degeneration, he is having breathlessness, not able to talk, even the slightest of the motion aggravates his breathlessness. And as the condition deteriorates, the pulse is rapidly increasing and getting more feeble and feeble. You see a lot of pulmonary congestion with him. Then you ask him only one question, can you tolerate meat? And he says no, the remedy is crataegus. This is the way, and there are many other ways where you see one small indication and you can come to a remedy. But every time you get such an indication, please corroborate with the other symptoms of the case. That is, we deal with cases we don't speak or cases where we have few symptoms.
Thanks for those inspiring examples, Dr. Gajanan. I'm sure this will inspire many practitioners to start observing for these peculiars because I'm sure many of us would never have known that such gems of rubrics exist in our books. Now, the next common question is on posology. And so, how do you select the posology in acutes? I mean, what determines potency selection and how often do you repeat?
Posology or selection of the dose is actually very important or equally important like selecting the remedy. And it is to be done on the principles that are laid by our teachers, especially by Dr. Kent in his lesson writings or Stuart Close or some of our teachers who we have been watching them from years together. So selection of the remedy basically depends on five important things. One is the susceptibility of the patient. This you will come to know when you take the history. Then the most important aspect is the seat of the disease, where the disease is located on which organ. Then the nature and the intensity of the disease, the stage and the duration of the disease, the length of the time which the disease has persisted in your body, and even the previous treatment taken. If he has taken a lot of allopathic medicines, then your remedy dose will change. If the disease has stayed in for you in your body for a long time, then the dose is going to be different. The practical bearing of this, as told by Jar, is in a given case when the symptoms are not clearly developed and there is an absence or scarcity of characteristic features in the case, or where you see two or three remedies seem to be equally indicated. Susceptibility and reaction, if it is regarded as low, we generally have to give the lowest potency, maybe 6C or the 12th potency. But when the symptom of a case clearly indicate one remedy whose characteristic symptom correspond to the characteristic symptoms of the case, we can give the higher potencies like the 200, the 1000 and even higher. Susceptibility is generally modified by pathological conditions. Remember, my friends, in certain terminal conditions, the power of organism to react becomes very low. When it becomes really very low, then only a material dose can help the patient. A common example is of a certain case of a valvular heart disease, where digitalis is an indicated remedy and no effect is produced by any potency. The patient will respond to a material or the mother tincture of digitalis to get a good recovery. The form of reaction complies perfectly with the requirement of the cure and the direction of disappearance of the symptoms and the nature of the results. So, in some cases where the susceptibility is very low, you may require a material dose. Kent in his lesser writing writes that in acute conditions, 1M and 10M are the most useful potencies. By this, the use of potencies in a given case, the patient can be held under its influence for a long time. And when the simillimum which you have chosen is sometimes required in series of potencies like 30, 200, 1M to have complete cure. If the remedy is only partially similar, it will act in generally one or two potencies. So you give 30 and 200 and then there is no cure that is happening. Then the symptoms change and that time a new remedy will be demanded. Now repetition is the most important aspect in a case where I feel three things are most important: the wisdom, the courage and the patience. Strong doses and frequent repetitions will not avail if the remedy is not right. And a single dose of an indicated remedy repeated whenever improvement ceases, as long as a new remedy is required, or if the new symptoms do not come, please do not change the remedy. The nature and the progress of the disease will be determined by the disappearance of the symptoms and the general or the mental state coming back to the normal first. A single dose of a properly selected homeopathic remedy will in short time transform the character of the disease as to show a indication of a different remedy if it is not completing the cure. When improvement comes to a standstill, it is advisable to give the second, third or the fourth dose of the same remedy. However, only as long as lessening of symptoms occur. But if the new symptoms are appearing, then we need to actually re-repertorize and see if it is an indication of a new remedy. That is what is written in chronic disease also. An alteration of symptom complex which is evident may happen when the selected remedy is not fitting, so must be exchanged for a suitable one as soon as possible. And no second dose should be given as long as the relief progresses even though slightly. The amelioration is apt to come in the mental state generally first. The mind becomes more tranquil and the suffering is more easily borne. So many a times in the case of fever, the fever may stay the same, but the child may ask for food, or the child may be active back again and the temperature is still the same. So by following these rules which are laid down by Dr. Jar, Stuart Close, Dr. Kent, we can actually assist the patient in recovery if we use the right potency at the right time. There are certain other ways of prescribing different potencies, like is the plusing method, which I generally use. Is many a times if I have to give the next potency, instead of going from 30 to 200, I may give 30 plus 1 and 30 plus 2 to get a slight of change every time by not going to the highest potency first. So this is all about potency. But again I am telling you, it is very important to learn potency with your teacher and see cases the way they change every time with when the teacher is prescribing, and his experience can become yours and will help you in potency selection many a times.
Thanks for that thorough, clear, concise explanation of potencies. So, the next barrier, I think, once you've prescribed the remedy, once you've given it in a suitable potency, is managing follow ups. So, in chronics, the follow ups are scheduled after a few weeks or even a month later. When do you see patients for a follow up in an acute crisis, and when do you change remedies?
Seeing a follow-up is a very important part of your first prescription, and that is where you come to know what you have prescribed has actually worked or actually did not show any result. And what to see in a follow-up is also an important art to understand if your remedy is working or not working. So I consider follow-up as a very important aspect of case taking itself, and it has to be done or understood in a particular order. It is not just the well-being of the patient in terms of the physical or the mental being is very important, but the overall look of the patient and the symptoms appearing after the first prescription are also to be seen in this case. Now, when I see a follow-up after the first prescription, yes, it is a very different way that I see. If a patient comes to me with breathlessness and asthma or in pain, I may ask the patient not to leave itself. I may ask the patient to take a dose and wait in my clinic till the time he starts feeling better. The moment he starts feeling better, I'll decide the next dose or not a dose and ask him to report maybe after a day or two. If the patient has fever, then the follow-up maybe after a few hours, where the patient reports to me about his generals first. See friends, what to see in a follow-up is a very important aspect. If the patient's fever is still there and his generals are improving, for example, he asks for a food to eat, or if he has passed a good amount of stools, or if he is sitting up, the energy levels are better. With the fever being there, it is a good follow-up. So in such a case, we need not repeat the remedy or wait for the next spike to come. So in case of fever, it will be few hours. If it is a cough, it will be maybe a day or two. Or if it is a joint pain or a rheumatological pain, maybe immediately within a day or after a week. So the follow-up ranges right from few minutes to a week. But every time you prescribe, the patient has to tell us something that within him has changed. If that something is not changing, then we need to look into ourselves if something is gone wrong with the case taking process. And the case taking process is not that it's only your mistake that we always do, that we have missed something. It may so happen that the patient has not told you certain things. So it is always better when you take a case, especially in acute, just for the patient symptom that you are repertorizing or taking for consideration for your remedy. Please see that you ask that symptom again, that is it this what you say is what I interpret or what I think, and confirm the symptoms so that you don't end up having a partially similar remedy. When to change a remedy? A patient comes to you with asthma, you are given a dose of whatever remedy you chose, and after half an hour the patient is still the same. Then you are wrong. In homeopathy, it is nothing that you are right always and you are partially right. Either you are completely right or you are completely wrong, especially in an acute condition. Or you have given a partially similar remedy that gives him a partial recovery. So that also you know that you have done a work which is half done. So there will be some symptoms which are remaining after the previous remedy. And then you know there is a possibility either of increasing the potency or either of changing the remedy if it doesn't fall in the same remedy. So every follow-up basically is like a case taking itself. You have to ask everything right from the physical generals to peculiars, everything. And it may so happen that the follow-up will indicate another remedy. And at the time when it is indicating another remedy, you need to change. If it is indicating the same remedy again, then you need to persist with the remedy. If the symptoms have been stable and steadily going down, you need not even think of giving the another dose. The same dose may continue. Or if the symptoms are still there and have got stagnant, then you may have to give a higher potency or for that matter the plusing method. So there are different ways and it is entirely the clinical judgment of the practitioner and the experience with which he has been doing. One, and it is from the books of potencies like Stuart Close or how different practitioners like Dr. Kent and others who have used this method of prescribing in different conditions. So that's all about how to see a follow-up and how to change a remedy.
Thanks, Dr. Gajanan. Now, as you know, most of the practitioners in my network are not medical doctors, and many have not been exposed to any acute crisis during their homeopathic training, nor even observed such cases before. So, what sort of books and materia medica should they refer if they were to excel in treating acutes?
This is my favorite question to be answered every time when a lot of my students ask which books to refer. First, the most important that I always tell is your clinical diagnosis that you read from the books of modern medicine, maybe Hutchinson or Harrison, how to clinically differentiate two different conditions and the changes that occur in those conditions. Now, the in acutes, the most important thing that you see is a physiological change occurring in the patient after getting exposed to the certain cause or in different conditions. If you can understand the physiological change that is occurring in the patient and if you know the disease process well, there are few homeopathic books which have described these things very well. One of the most important books is Dr. Fatak's Materia Medica, Dr. Borik's Materia Medica, and Dr. Allen's. Now these three books are real excellent clinical materia medica books where they have described the patient's condition in terms of the homeopathic symptoms as well as the pathological or the physiological transformation that takes place. Especially the first para, that is the generals. In the generals, they have described the exact sphere of action of the remedy. So you know that is your patient having the same affection which is described in the sphere of action of the remedy. Now these three books are the most important. Apart from that, the one that come to my aid very frequently is Dr. N.M. Chaudhary's Materia Medica, Dr. Farrington's Materia Medica, and Dr. Clark. These six clinical books have clinical symptoms which have been clinically verified time and again. Patients which they have treated and cured are the only symptoms that they are mentioned in the books. If you read the preface of Dr. Borik's Materia Medica, he clearly states that whatever is mentioned in the books, even if it's in diagnosis, is what has been clinically verified. So these books help us to come to the remedies much faster, and for sure when you are prescribed a remedy that this is going to work because it is written by these authors who are more of a clinicians rather than only people who write about the remedies by just experience. Another important aspect when you're prescribing an acute is to differentiate between two remedies. Now differentiating between two remedies is best done in a short form, in a short uh, description by Dr. Allens and Dr. N.M. Chaudhary. If you read Dr. Allen's Materia Medica, always it is in the bracket that he has used few remedies which have similar symptoms, or he has even given differentiations of those remedies compared to the remedy that you are reading. Similarly, if you read N.M. Chaudhary, N.M. Chaudhary also gives differentiation of different remedies in a similar condition. So that will also help you to clinically verify which remedy is a remedy that you need to give. Secondly, in many clinical conditions, you require to know if that clinical condition, for example, diabetes or rheumatoid arthritis or for that matter any other disease is covered by this remedy. So the pathological diagnosis is many a times given by Dr. Phatak and Dr. Borik in his repertory and in his books also. So you know that this condition is treated by this remedy clinically previously by some authors like Dr. Phatak or Dr. Borik. So these clinical conditions will always come to aid to your prescription if you have to see if the clinical condition is covered by the remedy or not. Another thing which I need to tell you is about repertory. Now when you are using a repertory, the repertories which generally I use is Dr. Phatak's repertory, Dr. Kent's repertory, Dr. Boninghosen's repertory, Dr. Nayer's repertory. Now these repertories are again very clinical. For example, in Boninghosen's repertory, the chapter on concomitants is unmatchable to anybody else. And a lot of symptoms you need to convert into concomitants and then take to have sure short results. So as regards to repertory, these are the repertories which will actually help you in clinical prescribing. So as I told you about the books, the same way is about repertories. These repertories, along with the books which I have told, are the essential aspects of prescribing in any acute conditions.
That's fantastic, Dr. Gajanan. Thanks for sharing your wisdom, your experience. It has been such a real eye-opener for most of us in the network. And I'm so excited to publish your, cases, your experiences, and your deep wisdom through your course, The Complete Guide to Managing Acutes with Homeopathy. So please tell us a bit about this upcoming course. What inspired you to make that, and what do you intend to share through that course? How will it help new as well as experienced practitioners in my homeopathy network?
So what inspires me to treat acutes or to teach acutes is only one thing. Maybe there are a few more that I can add to it. But the first thing which I started with it is when I started practicing, there was hardly any person who was there to teach me how to manage acute conditions. And whenever I used to ask teachers, they used to tell me go and read books. And when you read books, we used to never understand because our old teachers have written in small lines, which maybe it's very difficult for a new person to understand what he actually meant. Like for example, if you read Boger and the remedy silesia. He writes action on the tubes. You don't know which tubes he means till you understand that it means all tubular organs. And then you come to know that this is a wonderful remedy for the action on fallopian tubes, the intestines and the appendix and so many other tubular organs. This only you require a teacher to explain. One. Second thing is to see a change in an acute complaint. During our time when we started practicing was a rarity, and we were only told that homeopathy works in chronic conditions. But when we read our old masters, we found that they had extremely astonishing results, especially in acute as well as pathological cases. This actually inspired me to read more and more and see if our remedies work in acute conditions. And actually to start with, my practice always started with acute conditions and treating acutes and pathological cases. Maybe because of my background that I used clinical medicine a lot. But from that day, it was no turning back when I was treating acute conditions. And why I teach today acute conditions is because any normal practitioner who has to start his practice and who has to establish his practice, the first complaints which a patient will trust him is for his acute cold, cough, diarrhea and pains. And if you can give results and an option better than the modern medicine, with just a few doses you can revive the patient back to normal. This increases the patient's trust in you. And when the patient sees a magical result, he obviously has to trust you in any other chronic complaint too. So your practice actually builds up when you're treating acute complaints. Or for a practitioner who has been practicing only on chronic conditions. And my friends, it many a times so happens that when you have an acute exacerbation of a chronic complaint, most of the homeopaths they fumble or they prescribe according to their own whims and fancies, and they end up letting the case go to the modern medicine where the people they tell you that homeopaths don't understand how to treat this. But our old books and the homeopathic literature is rich in tips and methods how to handle acute exacerbations. This art is actually dying, and the whole attempt to make this course or maybe courses later than this is to revive this old art where homeopathy was in the forefront of treating these conditions. And it is all written in the books how to treat this. So for a practitioner who is practicing homeopathy for many years, it is still an additional boon if he has to use homeopathic medicines and not let the patient take the allopathic medicines or for that matter modern medicines when he can be actually managed with homeopathic medicines as much as possible. Now, why we have to use homeopathy in all given conditions? First, it is possible that we can treat most of the conditions with homeopathy. And in today's world, where patients are actually suffering because of the adverse effects of the modern medicine, they are looking for an option. And homeopathy has an option. It always had an option, but the homeopaths were scared because of the lack of knowledge of medicines and the lack of clinical knowledge that they can and the basic trust within themselves that they can treat it. This series basically should inculcate trust that we can do. If I can do, all can do it. It is nothing that anybody has learned it out of a blessing from God. It is pure science. If you can see it, if you can apply it, it is possible for anybody to do it. So I feel the modern homeopath, the new generation, should be equally efficient like any other system of medicine to handle acute as well as pathological conditions with homeopathy. That is my mission. That's what I feel. And that is why I am training students all over to understand this art and let it not go down in the books as a forgotten art of homeopathy.
That's amazing, Dr. Gajanan. I cannot thank you enough. We're privileged to have someone like you to handhold us as we take on resolving these acute situations with homeopathy. And as Dr. Gajanan says, no one is born with the skills of managing an acute crisis or the materia medica knowledge to prescribe instantly. It's a systematic process that anyone can learn and master, no matter whether you are a beginner or an advanced holistic practitioner. It is based on the hidden wisdom given in the old texts of homeopathy that is distilled and filtered through Dr. Gajanan's experiences of predominantly working with acute emergencies, especially in advanced pathologies. And Dr. Gajanan's results prove that this approach works instantly, in fact, even faster than conventional medicine. You just have to follow it. It's worked for the past masters who were incredible in managing these acute situations purely with homeopathy, such as Hahnemann, Bonninghausen, Burnett, Boricki, Kent, Fatak, and it's working for him in this contemporary world in his clinics as he works through thousands of patients in every type of acute condition that expands the boundaries and the scope of homeopathy and marvel his allopathic colleagues. So if you want Dr. Gajanan to train you on how to create a similar success in your clinic by showing you his real patient videos of case studies and of those follow-ups so that you can implement it in your cases, then I'm going to be opening his course very soon. I will be sending you all the details in just a few days. In the meantime, I would love to hear about what types of acute situations do you get in your practice and how will you implement Dr. Gajanan's approach. Dr. Gajanan has been reading and answering every query after his full day's clinic and he really looks forward to hearing from you. So please scroll down and leave a comment on how will you implement his approach in your acute cases.